On the morning of September 26, 1950, the United States Navy conducted a military operation over San Francisco Bay. No shots were fired, no bombs were dropped. The operation was quiet enough that the people of San Francisco did not know it was happening. 6 Navy minesweepers moved slowly through the waters off the coast, equipped with spray nozzles pointed at the sky. For 6 days, they released a fine aerosol mist into the wind coming off the Pacific. The mist contained 2 biological agents, Serratia marcescens and Bacillus globigii. The Navy's designation for the operation was Operation Sea Spray. Its stated purpose was to test how a biological weapon released by a hostile navy might disperse through a coastal American city, how far it would travel, how long it would remain airborne, how many people it would reach. The city of San Francisco had a population of approximately 800,000 people. Not one of them was told. The Navy's own records, classified for 27 years and released in 1977 following Senate committee hearings, document what happened after the spraying stopped. The aerosol dispersed through the city as the wind models had predicted. Monitoring stations the Navy had secretly placed around San Francisco detected the agents across the entire city. The Navy concluded that virtually every person in San Francisco had inhaled the biological material. In a real attack, the report noted, the entire city would have been exposed to a lethal dose. The operation was declared a success. Within days of the spraying, San Francisco's hospitals began seeing an unusual cluster of patients with urinary tract infections caused by Serratia marcescens, a bacterium that was, at the time, considered essentially harmless to healthy adults. The Navy had chosen it partly for that reason. But Serratia marcescens is not harmless to people with compromised immune systems, to the elderly, to the very young, or to people who are already ill. A man named Edward Nevin was admitted to Stanford University Hospital on September 29, 1950, 3 days after the spraying began. He was 75 years old. He had recently undergone prostate surgery. He developed a Serratia marcescens infection that spread to his heart. He died on October 11, 1950. Edward Nevin's family did not know what had caused his infection. His physicians did not know. The hospital did not know. The Navy knew, or should have known, that their operation had introduced Serratia marcescens into the air of the city where Edward Nevin lived. The connection between Operation Sea Spray and Nevin's death was not established until 1977, 27 years later, when the classified records became public. By then, Edward Nevin's family had spent nearly 3 decades not knowing. His grandson, also named Edward Nevin, sued the federal government in 1981 after the documents were released. A federal judge ruled against the family, finding that the government could not be held liable under the Federal Tort Claims Act for decisions made in the exercise of a discretionary function. In other words, the decision to conduct the operation was a policy decision protected from legal challenge. The legal reasoning is in the federal court record. The scientific record of the operation is in the Senate hearings. Both are in the National Archives. Now I need to tell you about the scale of what the government was doing, because San Francisco in 1950 was not a single incident. It was the beginning of a program that ran for nearly 2 decades across cities and communities across the United States. The Senate Select Committee on Intelligence, chaired by Senator Frank Church of Idaho, conducted hearings in 1975 and 1977 that exposed the full scope of the American government's biological testing program on its own citizens. The Church Committee hearings are in the congressional record. The testimony is public. The documents that were declassified as a result of those hearings are in the National Archives. What they reveal is a program that was systematic, deliberate, and conducted without the knowledge or consent of the people it used. Between 1949 and 1969, the United States Army and Navy conducted at least 239 open-air tests of biological and chemical agents over American cities, transportation hubs, and populated areas. 239 tests over 20 years. In cities across the country, the locations are in the record, the dates are in the record, the agents used are in the record. In 1953, the Army conducted Operation LAC, large area coverage, which involved releasing zinc-cadmium sulfide particles over a corridor stretching from South Dakota to Ohio. The particles were a simulant, meaning they were used in place of actual biological agents to test how aerosolized material would disperse over large areas. The Army's conclusion was that a single aircraft could effectively contaminate an area hundreds of miles wide. The operation's records are in the Army's own archives. In 1956 and 1957, the Army released mosquitoes carrying yellow fever over Savannah, Georgia, and Avon Park, Florida. The mosquitoes were Aedes aegypti, the species that transmits yellow fever, dengue fever, and Zika virus. The Army's stated purpose was to test the feasibility of using insects as biological weapons delivery systems. The residents of Savannah and Avon Park were not informed. Some residents reported unusual illness in the period following the releases. The Army's records of the operation, including the mosquito release data and the illness monitoring that followed, are in the National Archives. In 1966, the Army conducted an operation in the New York City subway system. Personnel carrying light bulbs filled with Bacillus subtilis, a spore-forming bacterium, dropped them onto the tracks at stations along the IRL line. The bulbs broke on impact. The spores were released into the air circulation system of one of the busiest transit systems in the world. Millions of people rode the New York subway that day. None of them knew they were breathing material released as part of a military biological weapons test. The subway operation is documented in Army records released following the Church Committee hearings. It is also documented in a 1975 report prepared by the Army itself, which described the operation in clinical terms as a successful demonstration of the vulnerability of urban subway systems to biological attack. The people who rode the New York subway in 1966 were not told they had been used to test that vulnerability. Now I want to tell you about St. Louis, because St. Louis is where the operation became something that required a specific kind of explanation. Between 1953 and 1954, the Army sprayed zinc-cadmium sulfide from motorized blowers mounted on buildings and vehicles in the Pruitt-Igoe housing project, a densely populated public housing development in St. Louis, Missouri. The Army's stated rationale was the same as the other operations, testing aerosol dispersal patterns. But Pruitt-Igoe was not a random test location. It was a poor, predominantly black neighborhood. The Army's own site selection documents, obtained through the Church Committee, show that the areas selected for testing were consistently areas with dense populations of low-income residents. In 2012, a researcher named Lisa Martino-Taylor published her doctoral dissertation at the University of Missouri examining the St. Louis operations. Her research, later covered in the St. Louis Post-Dispatch, raised a specific and documented concern. Zinc-cadmium sulfide is now classified as a toxic substance. The Army had mixed it with a radioactive fluorescent compound in some formulations. The health effects of the exposure were never systematically studied in the populations that were sprayed. The people who lived in Pruitt-Igoe in 1953 and 1954 were not told. The health records that would have allowed researchers to study the long-term effects of their exposure were never collected with that purpose in mind. What Martino-Taylor found in the archives was the record of what was done. What she could not find was any systematic effort to follow up on what the exposure had meant for the people who lived there. The operations continued until 1969, when President Nixon unilaterally renounced the American biological weapons program and ordered the destruction of existing stockpiles. The renunciation is documented. The destruction of the stockpiles is documented. What is not documented is any notification to the communities that had been used as test subjects, any acknowledgement that the people of San Francisco, of Savannah, of St. Louis, of New York had been exposed to biological agents without their consent. The Church Committee hearings produced that acknowledgement in 1977. Senator Church called what had been done a fundamental violation of the rights of American citizens. His statement is in the congressional record. The date is 1977, 27 years after Edward Nevin died in a San Francisco hospital with a Serratia marcescens infection that the Navy had introduced into the air of his city. The documents were declassified. The record was established. Edward Nevin's grandson went to court and lost. The Army issued no apologies to the residents of Pruitt-Igoe. The people who rode the New York subway in 1966 were never notified. Here is the detail that I cannot put down. The Church Committee hearings in 1977 were specifically about the CIA and military intelligence activities. The biological testing program was one of many things that came out of those hearings. The committee had a limited mandate, a limited staff, and a limited amount of time. Its 1977 report documented 239 tests. Researchers who have studied the program since believe that number may be an undercount, that some operations were never fully documented in the records that were declassified, and that the records that were destroyed before 1977 cannot now be recovered. 239 tests that we know about, in cities across the United States, over 20 years, without the knowledge or consent of the people who lived there. The question that the Church Committee asked in 1977, and that nobody has fully answered since, is how many people were affected and what happened to their health, and how would anyone ever know? In 1977, a woman named Dorothy Anderson received a letter from her congressman. She had written to him after reading news coverage of the Church Committee hearings. She lived in San Francisco. She had been born there in 1938. She had lived there her entire life. She had been 12 years old in September 1950 when the Navy minesweepers moved through the bay, releasing Serratia marcescens into the wind. She had breathed that air she had not known. Her letter asked one question: was her health affected? Her congressman's office wrote back. The letter acknowledged that Operation Sea Spray had occurred. It acknowledged that the Navy's own records showed that virtually every person in San Francisco had been exposed. It said that the Army and Navy had conducted follow-up health monitoring in the city following the operation. Then it said the follow-up health monitoring had not found evidence of widespread harm. What the letter did not say, what Dorothy Anderson could not have known from that letter, was that the follow-up health monitoring consisted of a single review of hospital admission records in the weeks immediately following the operation. It did not include any systematic long-term study of the health outcomes of the people who had been exposed. It did not include any effort to track individuals who might have developed health problems months or years later. It did not include any effort to notify the exposed population so that physicians treating them would know to look for Serratia marcescens as a possible cause of illness. The monitoring was designed to determine whether the operation had caused an immediately visible public health crisis. It was not designed to determine what had happened to the people of San Francisco over time. The distinction matters because Serratia marcescens infections can be latent. They can establish themselves in vulnerable individuals and cause problems that manifest weeks or months after initial exposure in ways that would not be traceable to a 6-day spraying operation unless someone was specifically looking for that connection. Dorothy Anderson's letter and her congressman's response are not in any national archive. They are the kind of private correspondence that exists in the margins of documented history. The individual trying to understand what was done to her, receiving an answer that was technically accurate and practically inadequate. She was one of 800,000. Most of the others never wrote. Now I want to tell you about the legal framework that allowed all of this to happen, because the legal framework is still in place. The Federal Tort Claims Act of 1946 allows citizens to sue the federal government for negligent or wrongful acts of government employees. It was a significant expansion of the government's accountability to its citizens, but it contains an exception. The government cannot be sued for acts that fall within a discretionary function, a decision made by government officials in the exercise of policy judgment. The courts have interpreted this exception broadly. When Edward Nevin's grandson sued the government in 1981 over his grandfather's death following Operation Sea Spray, the federal court ruled that the decision to conduct the biological testing program was a discretionary function. The government had decided, as a matter of policy, that testing was necessary to evaluate the nation's biological warfare vulnerabilities. That policy decision was protected from legal challenge. The ruling is in the federal court record. It established that the United States government could conduct biological tests on its own citizens without their consent, and that citizens who were harmed as a result had no legal remedy in court because the decision to conduct the tests was a policy decision, and policy decisions are exempt from liability. This legal framework has not been changed since 1981. The discretionary function exception to the Federal Tort Claims Act is still in place. The precedent established by the Nevin case is still good law. I want to be precise about what I am saying. I am not saying that the government is currently spraying biological agents over American cities. The biological weapons program was officially terminated in 1969. The Chemical and Biological Weapons Convention, which the United States signed in 1972 and ratified in 1975, prohibits the development, production, and stockpiling of biological weapons. There are verification mechanisms, however imperfect. What I am saying is that the legal framework that protected the government from accountability for what it did between 1949 and 1969 is still in place, and that the communities that were most heavily tested, the communities of color, the low-income housing projects, the neighborhoods without political power, received no accounting, no compensation, and no systematic health follow-up. Lisa Martino-Taylor's 2012 research on the St. Louis operations produced specific and documented findings. She found that the Army had selected Pruitt-Igoe and other low-income St. Louis neighborhoods for testing because their demographics and building density matched the Army's test parameters. She found that the zinc-cadmium sulfide had been mixed with fluorescent compounds in some formulations, and that the Army's own safety data on cadmium exposure was inconclusive. She found that no systematic health study of the exposed population had ever been conducted. The St. Louis Post-Dispatch covered her research in 2012. City officials asked for federal hearings. A congressman from Missouri introduced legislation calling for a health study of the exposed population. The legislation did not pass. The federal health study was not conducted. The people who lived in Pruitt-Igoe between 1953 and 1954 and who are still alive today are now in their 70s, 80s, and 90s. Their exposure occurred 60 to 70 years ago. A systematic health study of that population at this point would face significant methodological challenges. Many of the exposed individuals have died. Medical records from that period are incomplete. The baseline health data that would allow researchers to measure the effect of the exposure against a control group was never collected. The window for the kind of study that would answer the questions Martino-Taylor raised has not fully closed, but it is closing. Here is what the congressional record shows about how this was understood as it was happening. In 1969, when President Nixon terminated the biological weapons program, his announcement did not include any reference to the testing that had been conducted on American cities. It focused on the United States' commitment to international norms against biological warfare. It described the termination as a moral decision. The people of San Francisco, of Savannah, of St. Louis, of New York were not mentioned. The testing program that had used them as subjects was not acknowledged. The termination of the weapons program was presented as a forward-looking decision about American values. The Church Committee forced the backward-looking accounting in 1977, but the committee's mandate was broad and its time was limited. Its 1977 report documented what it found in the records that existed and were accessible. It could not document what had been destroyed. It could not document operations that were never fully recorded. It could not compel the long-term health studies that would have told the exposed populations what the exposure had meant for them. Senator Church called what had been done a fundamental violation of the rights of American citizens. The statement is in the record. What followed it, in practice, was the declassification of documents, the legal defeat of the one family that tried to seek accountability in court, and the passage of time. Now, I want to tell you something about that passage of time, because it is relevant to every person reading this who has family roots in the cities and communities where the testing occurred. If your family lived in San Francisco in 1950, they breathed the air that the Navy had seeded with Serratia marcescens. If your family lived in the Pruitt-Igoe housing project in St. Louis in 1953 or 1954, they were exposed to zinc cadmium sulfide. If your family rode the New York City subway in 1966, they breathed Bacillus subtilis spores released by Army personnel on the IRL line. They did not know. Their doctors did not know. No one told them, then or after. The Church Committee told them in 1977 in congressional hearings that most Americans did not follow. The documents in the National Archives tell them now for anyone willing to look for them. The Army's own records of the 239 operations are available to researchers through the National Archives and through Freedom of Information Act requests. The specific operation records include dates, locations, agents used, quantities released, and in some cases, weather data and dispersal modeling. They do not include health outcome data for the exposed populations because that data was never collected. What happened to your family is in the records. What it meant for their health is not, because no one in authority thought it was worth finding out. The documents were declassified. The Church Committee spoke. Edward Nevin's grandson went to court and lost. The people of Pruitt-Igoe waited for a health study that was never funded. The people of San Francisco received a letter from their congressman that was technically accurate and practically inadequate. The 239 documented operations ran from 1949 to 1969. 20 years. Across dozens of American cities, without the knowledge or consent of the people who lived in them. The legal framework that protected the government from accountability is still in place. The archives are open. The Church Committee report from 1977 is available through the Senate Historical Office and through the National Archives. The Army's biological testing records are available through the National Archives under Record Group 175. The specific San Francisco operation documents, including the Navy's own assessment that virtually every resident was exposed, are in those records. Lisa Martino-Taylor's 2012 dissertation on the St. Louis operations is available through the University of Missouri. The St. Louis Post-Dispatch coverage from 2012 is in newspaper archives. The federal court decision in Nevin v. United States is in the federal court record. It established that the government cannot be sued for what it did. That precedent is still law. If your family lived in San Francisco, St. Louis, Savannah, Avon Park, or New York between 1949 and 1969, the records of what the government released into their air are in the National Archives. The health records that would show what it meant for them are not there, because no one collected them. The documents were always there. What was missing was someone willing to read them. Subscribe, because next week we open another file.